Hi everyone, my name is Dr. Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia, Canada. And today I want to talk to you about zinc. Zinc is one of those super underrated nutrients that plays a role in a huge amount of things inside of the body. It is involved in hundreds and hundreds of different reactions, and there are a lot of claims around zinc. But the issue is people often don't give the context around zinc. So if you have been recommended zinc, it's likely that you were not told how to dose it, what forms to take, potential side effects. And this is a big issue because there's ways to take it properly and there's indications for it. And then there's times where you might not need zinc, or you're taking the wrong type of zinc, or you're doing it in an unsafe way. So today I want to clarify all of these things for you. As far as the importance of zinc goes, it is the second most abundant trace mineral inside of the body. So there's iron and then there's zinc. And it's estimated that about 15 to 30% of the population are not hitting their daily requirements of zinc. So our daily requirements, aka our RDA, for women, this is about 8 to 9 milligrams a day. For men, it's about 11 to 12 milligrams a day. And then if you're a pregnant woman, your requirements are more similar to that of a male's, which is around 11 to 12 milligrams. Now, this is your required daily allowance if you do not want to be high risk of deficiency. But what RDAs do not tell you is that that is the bare minimum. So if you are consuming more zinc inside of the body, so an example of a cold and flu, when you're using up a lot of zinc to try and fight that virus or whatever it is, your zinc requirements go up. Or you're not absorbing your zinc properly. Or something's causing a depletion of zinc inside of the body, so certain medications and things like that. Either way, in either of these situations, when you are needing more zinc, the RDAs are not going to cut it. And this is a common problem I see with RDAs, is this is talking about a hypothetical perfect situation. This is how much zinc you need. But if you need zinc in larger amounts for various different reasons, which is very common, then the RDA is not enough and you will become zinc deficient. So this is just something that you need to take into context when you read these RDAs. So now that I've dived into that, let's talk about why we even care about zinc. What is it actually being used for inside of the body? Well, it is used in hundreds of different reactions inside of the body, but that does not mean it's useful for hundreds of different things inside of the body. So what I mean by that is, hypothetically, zinc could be involved in certain steps of metabolism. That does not mean taking zinc will increase your metabolism. So there are certain places inside of the body that feel zinc deficiencies more strongly, that will show up more commonly in association with zinc deficiencies, and that will benefit more from zinc supplementation or increasing zinc inside of the diet. So that's what we're going to highlight for you right now. So the first and probably the most obvious use of zinc is for the health of your immune system. So generally speaking, zinc is important for the production of certain immune cells, and it has been very well studied to improve a cold and flu and prevent things from progressing further. So for example, it has been shown to shorten the duration of your cold and flu. So you will be sick for fewer days. And it will stop the progression of something like a cold from turning into pneumonia, which is a much more severe manifestation of a cold, where it goes deep inside of the lungs. So when they studied that, they found that pneumonia rates were reduced by 13%. And for just a tiny little mineral, I think that's incredibly impressive. So if you are a higher risk person of developing these things, you really do want to make sure that your zinc levels are adequate. And they even studied zinc in the infamous case of COVID-19. And they did find that it would reduce ICU admissions. So it would help prevent that COVID from going from a mild form of COVID to a much more severe form of COVID. And so zinc is a very helpful thing when it comes to improving the health of your immune system for various different reasons. Now, the second thing that I want to bring up gets a lot of airtime, and that is zinc's role with testosterone production. And now, before you skip this step, please know that this is also super relevant for females, so just hang tight. So, when it comes to zinc and testosterone, they have found if you're deficient in zinc, you're more likely to be low in testosterone. And if you take a zinc supplement in this scenario, it will improve your testosterone production. And so, if we think about this from a male perspective, the benefits are fairly obvious. Men will go through what we call andropause, which is essentially the male equivalent of menopause, where their testosterone levels start to drop as they age, and people start to see the health consequences of that, like increased body fat, decreased libido, poor brain functioning, things like that. And so in these scenarios, obviously taking zinc to help with that testosterone production is a good idea. When they looked at this in menopausal women, they also found that the zinc supplementation would improve aspects of this testosterone deficiency, like a low libido. So the women who were taking this improved in sexual arousal and things like that. So this is relevant for both male and female, and zinc deficiencies play a huge role in testosterone deficiencies. And yes, testosterone is important for everybody to varying degrees. So definitely something worth looking at if you suspect that you have testosterone issues. Another area that I use zinc a lot for is wound healing and collagen production. So zinc helps, generally speaking, protein formation inside of the body. And what are your muscles, skin, ligaments, bones, all of these different structural components of your body made of? Mostly protein. So the zinc is very important for this. And if we dissect that even further, collagen, which is the main protein in a lot of these structures, is very influenced by zinc. So that's what I mean when I'm referring to wound healing and collagen formation. They kind of go hand in hand. You have to form new collagen in order to heal. So this is important for things like joint injuries, but also for skin health, for repairing damage inside of the gut. Essentially, any repair of anything structural will require more zinc when you are trying to heal that. And as I'm going to touch on a little later, there's a certain form of zinc that is particularly helpful when it comes to healing up the gut. So people who have really inflamed and damaged gut lining would benefit a lot from something called zinc carnosine, which I will talk about a little bit later on when I go over the different forms of zinc. So zinc deficiencies are going to put people at a higher risk of prolonging that healing time, or maybe not making a full recovery altogether. So this is something definitely worth considering if you're trying to heal anything structural inside of the body. Now, interestingly enough, zinc is also super important when it comes to our blood sugars, but more specifically when it comes to insulin. So insulin is a hormone released in response to elevating blood sugars. So when you consume something and your body gets rushed with all the sugar from that food, your insulin is released to try and keep those levels down and prevent them from going so high that it's damaging inside of the body, which is essentially what's going on when people become diabetic. Those blood sugars go high and they stay high because the insulin in a lot of these scenarios is not working well enough. And zinc is very important for the production, the secretion, and the function of insulin on your body. So zinc is a very underrated tool when it comes to helping optimize your insulin. And if you're zinc deficient, you are more likely to have insulin issues, thus putting you at a higher risk of developing things like diabetes. And considering the fact that about 10% of the population is diabetic, And an even larger percentage of that population is what's considered pre-diabetic, where insulin issues are starting to come up. This is very relevant. So something definitely worth considering, especially if you have a family history or anything else in your health that might put you at a higher risk of developing diabetes. Now, these are not the only areas in which zinc deficiencies are relevant, but I did want to highlight those for you because they're very big areas of health and there's a lot of good research behind it. But zinc deficiencies have also been linked to certain types of Alzheimer's, to something called tinnitus, where it's ringing in the ears, loss of taste and smell. If you're zinc deficient as a child, growth issues are definitely going to become a problem, development issues. Skin health is also heavily influenced by zinc levels, so things like eczema and acne can be impacted. Hormones in general are impacted, so it can be related to things like infertility, poor DNA repair, increased LDL, which is our bad cholesterol and a huge risk factor for developing really severe cardiovascular disease. We also will notice that people who have head injuries or post-concussive syndrome, they are worsened by zinc deficiencies. Depression can become worse by zinc deficiencies, and so on. So now you might be wondering, why are zinc deficiencies so common? Well, certainly in developing countries, it can be an issue of access to zinc-rich foods. But if we're talking about developed countries and why they might develop more zinc deficiencies, it can get a little bit more nuanced. When we talk about the different food sources of zinc, it's generally speaking red meat, poultry, seafood, certain nuts, seeds, legumes, fortified cereals, and in fact, oysters, which are the highest in zinc, will have about 39 milligrams per 100 gram of oysters. So that's the equivalent of about 8 oysters. So they're just jam-packed with zinc, which is why they have this claim around being an aphrodisiac, because if it's going to increase your testosterone, which is very linked to libido, that is potentially why people say oysters are an aphrodisiac. It's certainly not because they're super sexy to look at. Now, if we think about plant-based sources of zinc, they tend to be less rich in zinc, and they also have something called phytates, which I will mention later, which kind of inhibit some of the absorption of it. But for example, pumpkin seeds, which are one of the best plant-based sources of zinc, has about 1 milligram per tablespoon of pumpkin seeds. So you just might have to consume a little bit more if you're eating a more plant-based diet, which is definitely achievable, but it does put vegetarians at a higher risk of developing a zinc deficiency. Other reasons you might become zinc deficient are if you have gut issues. So if you have more severe manifestations of gut issues like celiac disease, like Crohn's, like ulcerative colitis, where you are having a lot of bowel movements a day, your minerals will tend to get lost with all of the loss of fluids that come out with really severe diarrhea, for example. And then, of course, if there's a lot of destruction inside of the gut, it's also going to make it harder to absorb your nutrients. So that's more of a risk factor for like any type of deficiencies, but zinc certainly also applies to these scenarios. Increasing the consumption of alcohol and cigarette smoke will also deplete your zinc. They have also found that menopause, which causes a drop in your estrogen, which estrogen is helpful for zinc absorption, can also lead to deficiencies. They have also found that the farming practices that we currently do are not conducive to high amounts of zinc. So I've touched on this briefly in the last video where I talked about magnesium. So I did a whole highlight on magnesium, and this was brought up there too, where the farming practices, like the heavy use of pesticides, for example, will deplete the nutrients in our soils, and our minerals are very susceptible to that. So it's very well known that zinc in our soil is not as high as it used to be. So the foods that we used to rely on for a source of zinc won't have as much as they used to. And that's a very important aspect of zinc deficiency. So adrenal stress will also decrease our zinc. So our adrenals are glands that release our stress hormone cortisol. And so if we're highly stressed a lot of the time, our zinc can tend to go lower as well. And then lastly, if we're doing anything that increases our copper inside of our body, so things like copper IUDs and certain other things like copper piping in certain households where you're getting an exposure of a high amount of copper, that will decrease your zinc. I'm going to talk a little bit more about that when I talk about the absorption of zinc, but copper and zinc tend to not play well together. So if one's too high, the other's low, and vice versa. So the direction is both ways. Okay, so now that I've gone over why zinc's important, why we're developing more deficiencies in zinc, let's talk about what you need to know if you're going to take a zinc supplement. Not to say that you couldn't do it through diet alone, but if you are going to take a supplement, there's some things that you need to know. There are three main things that are going to block the absorption of zinc. The first one, which I've already talked about a little bit, is phytates, which are a compound found in a lot of plants. So a lot of these plant-based sources of zinc also have phytates in it. And so even if this particular food has a certain amount of zinc, it's going to be slightly lower than what it claims because the phytates will block the absorption inside of the gut. In fact, about 50% of that zinc can be blocked by the inclusion of phytates. So if it's a food that is high in phytates, it can block up to 50% of that zinc inside of that food. But the good news is there are certain techniques you can use to decrease the amount of phytate inside of that food. So that's where things like soaking, fermenting, sprouting, things like that come in, because they will increase the level of something called phytase, which is an enzyme that breaks down those compounds, and therefore it'll improve the absorption of the zinc inside of that food. The second thing is the competition with other minerals. So again, as I mentioned earlier, copper is probably the best known for this. Too much copper will block zinc absorption, and therefore you will become zinc deficient. To be honest though, what you more often will see is the reverse of that, because typically we're not exposed to too much copper, hopefully. But if we're taking zinc over 40 milligrams for a long period of time, it can very much deplete your copper. And then you will exhibit signs of copper deficiency. But do know that you need far less copper than you do zinc. So even if you're worried about this because you're taking maybe higher amounts of zinc for longer periods of time, it's not like a 1-to-1 ratio. So say you're taking about 15 to 30 milligrams of zinc, you only need to be supplementing about 1 to 2 milligrams of copper to balance that out. So please do not think that I mean you need to match your copper intake to your zinc intake. Copper deficiencies are an issue, but copper excess is an even bigger issue. So do be careful when you're consuming any sort of copper supplementation, because copper does not need to be in high amounts inside of the body. The other mineral that commonly can kind of block the absorption of zinc is something called iron, which I'm sure all of you have heard of. And much like copper, the direction does go both ways. If you separate these two supplements, so say you take an iron and you also want to take a zinc, just don't take them at the same time because they're kind of competing for absorption inside of the gut. The last thing that I want to mention is low stomach acid. So low stomach acid is very common from lifestyle factors like high stress and poor sleep. It's also very common because a lot of us are on acid suppressing therapies like PPIs, and they have been very well known to deplete your zinc levels because you need adequate stomach acid to absorb zinc among a lot of other nutrients. So that's another area where you can really start to notice that your absorption of zinc is getting impacted. As far as the safety of zinc goes, it's generally considered quite a safe supplement, but there are certain side effects that can happen as you're taking the zinc. So even in moderate doses of zinc, it is very common to get gut upset if you do not take it with food. And I'm talking about like a hearty meal, not just like a little snack like a granola bar or a banana or something like that. So common gut upset symptoms would be things like nausea, stomach pain, cramping, and even vomiting. And certainly once you get into the high doses, it's really not necessary to dose zinc that high. But even in the smaller amounts, if you don't have something in your stomach, you can get lower grade reactions like nausea and things like that, especially if you're more sensitive to zinc. So this is something that I tell everyone just to be aware of, because if you take a supplement and you feel like crap and you're wondering why, it might be that there's zinc in it and that you didn't take enough food with it. Okay, the last thing before I wrap up here is I want to briefly touch upon all of the different forms of zinc. So this is going to be super brief, but if you look at the list, there are a bunch of different types of zinc. And in the brackets, I have for you how much zinc is actually in that particular form. So even though it says it has 30 milligrams of zinc carnosine, for example, that does not mean all of that 30 milligram is pure zinc. And so, as you can see, some of these forms have a higher percentage of zinc relative to the other compounds, and this is something that you want to pay attention to. But something that's a little bit more important than just how much zinc is in it is how well that zinc is absorbed. So they don't have a lot of good studies where they look at every single one of these forms against each other. So I've kind of come up with a list that, from the information I've gathered, this is kind of the order in which I would put these things in, from most bioavailable, so most absorbable, to least. And please know that this list is probably not perfect because there's no direct study to reference to, but generally speaking, there are forms that are better absorbed than others. And then just quickly, I will highlight a couple key forms because they have some unique features to them that might make you want to choose it versus another. So if we look at zinc bisglycinate, one of its key claims to fame is that it doesn't interact with minerals. So you can take it with something like iron and you don't have to worry about those two things competing for absorption and blocking the other one. So that's a really cool feature of something like zinc bisglycinate. The other form is zinc carnosine, and I want to highlight that one because even though it might not be the best absorbed form, it has a really cool role when it comes to gut healing specifically. So as I mentioned earlier, zinc as a whole is very important for gut healing, but the carnosine component of it helps stabilize it inside of the small intestines and will also help it further work to speed up the recovery inside of the intestines. So that would be the form that I would choose if I'm trying to have more of a local gut effect. Maybe not the best form if I'm just trying to overall boost my zinc levels. So those are a couple of the key features of the different forms. There are certain forms that I probably would never use, like a zinc oxide, but then when it comes to like the top three, they can be used fairly interchangeably. There's not like there's one particular form that seems dramatically better than the others, but this is just a loose guideline in case you were curious about what form is inside of your supplement. So we're basically done here, but I just want to leave you with my top tips. So a little summary of my top tips around taking a zinc supplement. The first one, which I just mentioned, is take it with food. It is really unpleasant if you don't take it with food, and you are not going to stick to that supplement regime if you take it on an empty stomach. It is very likely to cause gut upset. On that same line of thinking, if you can take it away from phytates, so taking it away from foods that are high in phytates or relying less on those forms in order to get it through the diet, that's great. But if you are going to have phytates in there, please soak them or ferment them so your phytate count goes down. As far as when to take your supplement goes, which is a common question that I get, there is no real reason to take it during the day versus the night. It's not like it has a stimulating effect, so it doesn't have to be a daytime or a nighttime supplement. What you're more going to want to pay attention to is what you're taking it with, because it has some of those interactions with other minerals, because it wouldn't play well around the time that you take your acid suppressing therapies, things like that. It's more about timing your zinc around your other supplements or medications rather than it having to be a daytime or a nighttime supplement. If you're going to take above 40 milligrams a day, pair it with a copper supplement, whether it's copper in a multi-mineral or something like that, or copper by itself. Those two need to be balanced out. And then the last thing, which isn't something I've mentioned already, but is just super interesting, is you can take your zinc with nutrients like quercetin to improve the absorption. And this was studied a lot when we were talking about the immune system effects of zinc. They found that if you put quercetin as well in there, it helps the zinc absorb better into the cells. So that's a quick little hack that I have found in the literature. So I hope that you found today helpful. If you're going to look into zinc, I hope that this provided all of the information that you needed to make an informed decision. If you have any questions or comments, please leave those below. And if you can throw me a like and subscribe, that is always appreciated as well. I hope to see you guys again soon and have yourself a great day.